Good morning, everyone. Thank you so much for joining us for our press conference announcing a new backup power mandate for assisted living and nursing facilities within unincorporated Harris County. My name is Sion Rhodes. I have the pleasure of serving as press secretary for Commissioner Lesley Briones, Harris County Precinct 4. We are joined today by the Commissioner, Lesley Briones, followed by Chief Lori Christensen, who is the Harris County Fire Marshal. We will then hear from Greg Shelley, who is manager of the Long-Term Care Ombudsman Program with UT Health. Now, please help me welcome Commissioner Lesley Briones.
Good morning, everyone. I'm Lesley Briones, and I'm grateful to be serving as your Harris County Commissioner for Precinct 4. Happy New Year to everyone. As we came here on this very frigid Texas morning, I want us all to be reflecting. Today is a great day in Harris County because Harris County is setting new standards for safety, and Harris County is taking action to protect our senior citizens and to protect our most vulnerable residents. We all can vividly remember the repeated extreme weather events that we have endured. And with these repeated events, we need to make sure we have the regulations in play to protect especially our seniors and most vulnerable residents. So what Harris County Commissioners Court did is in November, we unanimously passed an amendment to the Harris County Fire Code. Now, as of January 1st, here in Harris County, the fire code requires backup power generation systems for HVAC systems in assisted living facilities and nursing homes. And in a second, I'll break that down in terms of what it means. But I want us just to reflect back to 2021, February, Winter Storm Uri. 10% of nursing homes in Texas and nearly 33% of assisted living facilities across Texas lost power. And we lost over 100 seniors in Texas. That is unacceptable, and as proud Texans, we can all agree that we must do better. Here in Harris County, we are taking steps to do better and protect our seniors. During Hurricane Beryl this past July, there were 14 nursing homes and 30 assisted living facilities without power following Beryl. And we know that at least one of our Harris County residents, one of our seniors, passed away given the extreme heat. So there's a dearth of federal and state regulation, and you have to dig into the specifics. But this amendment here in Harris County will do the following. So now we will have to have these reliable backup systems. So these backup generators will help save lives and protect our seniors and most vulnerable residents by 1, helping to maintain safe temperatures, 2, powering critical medical devices like oxygen machines during outages, 3, enabling emergency alerts and communications, 4, ensuring access to medications, and 5, helping to support secure evacuations. So by having these secondary power systems, we are adding additional protection and controls and safety measures for our seniors. This became effective January 1st, and by the end of 2025, the approximately 120 assisted living facilities and nursing home facilities in the unincorporated areas of Harris County will need to comply. So we will proactively be providing information and support so that these facilities can be in compliance with these new regulations and so that all of our loved ones are safe. I want to thank the best Fire Marshal in the United States of America, which so happens to be our Harris County Fire Marshal. I have nothing but love and respect for her. She's paving the way and taking us to new heights. Chief Lori Christensen, her and our Harris County Fire Marshal's team are responsible for this improvement and do so much to keep us all safe every day. So we can take a moment to express our gratitude. And for all the team members who are here, if you could stand up so we could show our respect for your sacrifice and service. And I'd also like to thank the partnership of Harris County Engineering Department, who were instrumental in making this happen. So thank you to everyone here from the engineering team, as well as the Harris County Precinct 4 team, especially our policy team, who worked very closely with the key stakeholders to make this happen, and it passed unanimously at Harris County Commissioner's Court. I'd also like to thank Greg Shelley, who we'll hear from momentarily. He is the Senior Program Manager at the Harris County Long-Term Care Ombudsman Program at UT Health Houston. So again, to me, I'm proud of this day, not only as a Harris County resident, not only as your Harris County Commissioner, but as somebody who absolutely adored my grandparents. May they rest in peace. But this is for all of our families, whether it's our parents, our grandparents, our great-grandparents, all of us. We're all aging, and this could be us. So we know in the next freeze, the next oppressive heat, the next hurricane, the next derecho, that there will be backup systems in place here in Harris County, because we are taking the lead in setting higher standards of protection and safety. Very briefly in Spanish, I will do a brief version of these. Buenos días a todos, feliz año nuevo. Soy Lesley Briones, soy su comisionada del Condado Harris, Precinto 4. Gracias por estar aquí. Primero, quiero dar las gracias a Lori Christensen, jefa de Departamento de Bomberos del Condado Harris. Muchas gracias a usted y su equipo que cada día nos sirven y nos protegen. Muchísimas gracias. Y también a Greg Shelley, gerente del programa de cuidados de largo plazo de UT Health Houston. Gracias, señor Shelley. Los recientes apagones afectaron a millones de personas en nuestro condado. Con Beryl, 14 hogares de ancianos y 30 centros de vida asistida no tuvieron energía. Por eso, hoy damos un gran paso adelante para cuidar a nuestros adultos mayores y a otros residentes vulnerables. Ya está en vigor una enmienda al Código de Incendios aprobada por la Corte de Comisionados en noviembre. La medida exige sistemas de energía de respaldo en centros de vida asistida y hogares para ancianos durante las emergencias. Estos generadores servirán para hacer esto. 1. Mantener temperaturas estables. 2. Dar energía a máquinas de oxígeno y otros dispositivos médicos. Asegurar el acceso a medicamentos y también ayudar con alertas y llamadas de emergencia, entre otros. Esta medida es fruto de nuestra alianza con la Oficina de la Jefe de Bomberos y el Departamento de Ingeniería del Condado Harris y otros socios como UT Health Houston. Y debe cumplirse antes de finalizar este año. Seguiremos trabajando en equipo para hacer que este condado, el Condado Harris, es más fuerte y resiliente. Y recuerden que estamos aquí para servirlos y a sus familias. Y esto es muy personal para mí, no solamente como su comisionada y un residente del Condado Harris, pero pienso en mis abuelos, que ellos pasaron sus últimos días en estos hogares para ancianos. Y ahora en el Condado Harris, ancianos como nuestros papás y abuelos y bisabuelos ahora van a tener más protección. Así que en la próxima huracán o en una temporada de invierno fuerte, vamos a tener un sistema que protege a nuestros queridos más. Y eso es lo que todos en el Condado Harris merecen. Y vamos a estar luchando aquí en el Condado Harris para nosotros. Vamos a ser líderes en la seguridad pública para todos nuestros residentes, especialmente para nuestros familiares ancianos y nuestros residentes vulnerables. Así que muchísimas gracias. Vamos a seguir adelante juntos y vamos a hacer que este condado sea el mejor en el estado de Texas y en Estados Unidos. Next, we will hear from the one and only Harris County Fire Marshal, Chief Lori Christensen.
First, I do want to give Commissioner Briones and Commissioner's Court recognition. I will say we are very fortunate here in Harris County to have the members of court, Commissioner Briones, who constantly challenge us. Instead of just letting things happen, they come to us and they say, what can we do better next time? And this was a challenge. We are the first county in Texas to adopt this as a standard and amendment in our fire code. We also understand that there is a cost to this to the businesses, and that's why we gave this period of let's work with you, let us help you get to the right place and where you need to be and the right equipment. We want to work with you and educate you. I think the key here is we all have family. Like I said, Commissioner said, we're all aging. But at the end of the day, when we take our family members to these facilities, our goal is to ensure they're in a safe place at all times. And many of us are not aware that these facilities do not have the power backups. And those power backups, it's not only about the air and the heat, it's about those critical life safety systems. Many of these residents are on systems that if the fire department is not able to get there in time because they're responding to other emergencies, we know we have ambulances out running, and during an emergency, things are happening. If they can't get there in time, these people are at risk, and we want to make sure they're safe. So I really am excited to see that Harris County is leading this way. I know that, working with our, what I like to say, our residents, but also our customers in these facilities, that's why it's so important we're working with people like Greg Shelley, because this is an education tool. We're going to be going out, and we're going to be taking these cards out, and I know you're even going to help us pass these out. This is going to be to the assisted livings, to the nursing homes. And what it does is it gives them the guidelines. It gives them a link. My team is going to be here to sit down and work with them. We're also going to be working with our local members of Health and Human Services, some of the local members of the chambers. We want to sit down and make this happen in a way that works for everybody. And at the end of the day, we understand. I know I've been asked, well, what happens if they don't comply? Well, we're going to work with people that even if we have to have an action plan, and that action plan means, hey, it may take them a couple more months, or it may take this. They're going to have an action plan. And in that action plan, it's not going to be, well, we're going to have to wait because a generator is on order. No, it's going to be, what is your action plan? Something happens, you don't have this backup generator, so now you're going to have a way to get these people to a safe location, and you're going to have evacuation plans. You're going to make sure their family members are aware what you have at your facility in case they need to come pick up their family members. It's all about communication during an emergency. And when you look at our fire code, a lot of people think of enforcement. It's not about enforcement, it's about education. Our goal is to prevent a fatality before it happens, whether it be by fire, heat, cold, any of those things. We want to save lives before they need to be saved. So I really want to thank, like I said, court members, and I really want to give strength to my team. I'm very, very fortunate that I have some members who have significant certifications, even above mine, and that sit down and do the research. This is not just a Texas problem. This is a national problem. But we're trying to find a way that we can fix it on the local level. Thank you. And Mr. Shelley?
Yes, I'm Greg Shelley. I'm the managing local ombudsman of the Harris County Long-Term Care Ombudsman Program over at Cizik School of Nursing at UT Health Houston. We are advocates for the folks who live in nursing homes and assisted living facilities, so part of that mandate is helping to educate people on their rights and their options and give good counsel about what might be a best next course of action. One of the important parts of our program is that folks understand that all conversations with us are confidential, and we're the only non-mandatory reporters of abuse, neglect, and exploitation, because the residents need to keep control of their situations, and they need to know that they can confide in us and get good advice on where to go next. So as advocates for those folks, I'm proud to say thank you to Commissioner Lesley Briones, Chief Lori Christensen, and all of their Harris County staff for their incredible work on this very vital issue. It's one that we have pushed for in the legislative world for quite some time. And in this case, I'm really proud to be part of Harris County, who's leading the push for it and actually taking action before there's further potential for damage. Older adults simply have a more difficult time regulating their body temperatures and are at increased risk of both hyperthermia and hypothermia. And in these facilities, the residents are particularly vulnerable to heat or cold-related, temperature-related injury and death whenever power is lost and there's no ability to heat or cool the building. Residents and their families often expect that these long-term care facilities can continue to operate during weather-related situations, emergencies, and they generally assume that these long-term care facilities can operate both lighting and heating and ventilation whenever power is lost, but the reality is much different. Nursing homes have a federal rule that requires them to have a generator of some kind, but it's very limited in what it does, and it might have, emergency exit lighting, but the vast majority of them do not have the ability to control temperature when power is lost. Assisted livings have absolutely no requirement for that, and in 2022, the HHSC study that was conducted as part of an outcome of the previous legislative session, they found that only 47% of assisted livings in the state had a generator of any kind, and only 63% of those actually had the ability to operate heating and cooling systems. That's about 29% of all the assisted livings only. So the Ombudsman, of course, recommends that nursing facilities and assisted living facilities have the ability, with a well-maintained generator, to operate both heating and cooling systems whenever power is lost. Unfortunately, current law doesn't require that for either the nursing homes or the assisted livings, and for that reason, and many more, I'm happy to applaud our Harris County officials for their leadership on this very important issue. And as Chief Christensen had mentioned, for the assisted livings that may be the smaller assisted livings, some of these are for residents only. They're small residential places, and they aren't like what I would call a higher end, large apartment style place. They might struggle with some of the cost. It is a one-time cost. It is one that's very important and vital. It's also one that gives facilities a competitive edge. The fact that 29% of the assisted livings in the state already have them, that gives them a competitive edge when it comes to getting residents into the building. But I encourage them to look at the Texas Backup Power Package program that started in January of 2024. They may be able to get a loan or even grant money to equip their buildings with it. So thank y'all very much. I'll turn it back to you.
So I'm proud that Harris County is the first county to make these very critical changes to the fire code. I hope every other county in the state of Texas will join us in enhancing these safety protections for our seniors and most vulnerable residents. And as the experts have said, this is a national issue. So I hope this will spread across the United States. But meanwhile, here in Harris County, we're committed to continuing to take action and make sure we are standing up, showing up, and doing everything possible to protect our seniors and most vulnerable residents. So I thank all of our partners. I thank our wonderful fire marshal and all of our team members who every day are out in the field keeping us safe. So we're in this together. All the facilities who are impacted by this amendment, as we have said, we're here to support you. We're here to work as a team so that we can make these changes, which will be a win-win for all. So with that, it's a great day in Harris County, and we are here to take any questions that the media may have. Thank you.
The Texas Backup Power Package, that's the one that I know of state-specific. It's more of one that would probably be advantageous for these smaller assisted livings to look into. On the nursing home side, there's opportunities through Centers for Medicaid and Medicare Services, and under Medicaid, there's opportunities to get money to make sure they have a better disaster preparedness plan in place. The details of that, I'm no expert on.
So, again, this just passed and it went into effect. We're not only are we notifying them, but we're going to be educating them. But I will say this, there are things that we can do working with the state of Texas and HHSC. They know this amendment has been put in. There are things that we can do through citations. That's not our goal. We really don't want to do that. But we also know that we don't want to displace the community members that are at a facility. So I want to be clear. It's not a matter of, okay, this place cannot operate because it doesn't have this. We're going to use the administrative capabilities that we have to work with these teams, just like I mentioned. I understand that, and I know I've got a couple of my friends that they're looking at generators and they're on order. There may be some that can't come in time. There may be some situation where they have to get an additional permit or they have to do something electrical. Again, if we're working with them starting now and we're working with these kind of team members and getting the word out, we truly believe that even if they can't have these systems in place for whatever reason, we will find a way to make sure they have a system in place to at least evacuate those residents. But what I would hope is that we don't even have to get to any formal means of working with these folks, because I do believe every one of us, and I tell you what, when I go into these locations, I go into these assisted livings and these homes, the people there really do care about the residents there. And I think that's what we've got to remember. They were not expecting this to happen. It wasn't anything they had planned for. Obviously, this is something, as Commissioner said, it's something that is even on the federal level and state level hasn't been recognized. We're recognizing it now. I think those homes and those facility owners are recognizing it. And I do believe, just by us talking to them already, they were very supportive of this, and many of them even offered us suggestions as to how we could help them put this into code. So I hope that answers your question. I think it's very important, and we learn this. You think about, what I would say is this. If you're taking a family member or a friend or somebody you're responsible for to one of these facilities, think of it as if you were going into a new home or a new location. You want to know, do the windows work? Are there exit doors? Is anybody checked to make sure there's no gas leaks? What's going to happen in case of emergency? Who's the local fire department? Who's the local law enforcement agency? Do you have a written plan? Because it is required, and I know you could speak on this a little bit more, they were required to have emergency operations plans. We're already inspecting them as the AHJ, Authority Having Jurisdiction. The Fire Marshal's Office already inspects them because the state requires that they have an annual fire inspection. That's why we're just going to add this to that. But they already have to have those things in place. You, as a family member, should be able to ask those questions. And you actually just gave me a great idea that I'm going to tell Brandy, my communications director, about, and actually listening to Greg, and I know Commissioner's team's amazing. That's a great idea. Maybe we should have a checklist put together and what you should ask, because you can't expect people to know what to ask. So we'll work on that. Thank you for that.
I'd like to add, one of the things that we do is help folks decide on where to go to get care, because we do visit all the facilities. We can give them some tools that are already out there in terms of gaining knowledge about the particular facility they're considering. But because we also visit the facilities, we know a lot more about them than what you would find out online or looking through previous, maybe HHSC surveyor interventions or whatnot. But one of the things that obviously I think all of us locally have gotten even wiser about, even individually, is how much more frequent these events are. And with the derecho in May and the impact of Beryl, many of us were impacted personally at our homes and lost power. So too, as we saw, did these facilities. So more and more consumers are getting a little wiser about what they're asking up front. That's an important thing that we encourage in assisted living, and it's something that we locally even started tracking for the assisted living that we visit, to find out if they have those kinds of generators or whatnot, so we can point people in those directions. Like I said, some of the folks that are already in compliance with this and have been for years, are, they already have a competitive edge in terms of getting people in. Thanks.
Any other questions?
Yes, sir. So here's what I'll say. Again, I mentioned earlier, because it's already required by the state, these facilities do already pay for an annual inspection. And in order for the state to update their license and renew it, we're already out there doing inspections, whether it's on fire and life safety systems, exit doors. We look at their emergency operations plans. This is going to be another box we have that we check. So what I would say is we're going to be able to use the staffing that we already have in place. And, you know, if because Harris County is a safer location now, we get more of these facilities, then I'll get with court and let them know we might need. But hopefully we see more people wanting to come to Harris County because it's where you know you and your family members can be safe. Thank you. Independent senior living facilities? And what do you mean by independent? I want to make sure I understand.
Ones that like aren't subject to the same state and federal guidelines. Because I just would ask over the past year,
Mm-hmm.
you know, not only nursing homes and the assisted living facilities were a big problem, but those independent ones were a big problem because they're not subject to the same regulations. And I know the city has kind of been trying to brainstorm ways to hold them accountable.
Yes, ma'am, and if I'm, correct me if I'm wrong here, I believe you mean what I like to call the 55, I'm over 55, the 55 and plus locations, and so that's a great question. So when you say independent, what these are, most of these are, some call them condo complexes, apartment complexes, and they cater to an age group of 55 and plus. There are no requirements. They are a complex like you and I would go into. It's just if we're not old enough, we can't get in. There are no requirements. That's a great question. One of the things I was just talking to Commissioner about, and she's very involved in the legislative session and is up there quite a bit. We actually, Harris County Commissioners allowed me to speak at the hearing for on the generators at the Senate hearing. One of the things we talked about is there legislation that could put into the Texas Property Code, because that's where your leases are, right, in your Texas Property Code, that would put a requirement in there of what you put on your lease, and it could be in big, bold letters. This facility does not have backup power because, again, it's not licensed. It's not required. But you need to know that. If you as a resident, and many of us, like I say, at my age, I mean, I'm old enough, I could go into one of these facilities. I can read it for myself. I need to know, what are your plans for me? And a lot of these complexes are 3 and 4 stories high. So I think that's a great question. I'm going to really push and continue talking to Commissioner about what we can do on a legislative level, because that's not necessarily something we could do right now in the fire code level. And I want to make sure this is clear. And I know we talked about it. This is unincorporated Harris County, although we're very closely with all of our cities, City of Houston, Pasadena, Deer Park, all those cities. We are sharing this information with them and offering to assist them if they want to adopt this. But that is something we really need to work on, is these, what you called independent, I call 55 and plus, because that's exactly what they are. They're independent living. You don't need assistance until you do. Thank you. Yeah. Yes, ma'am.
I have a quick follow-up. You kind of actually segued perfectly into it. You know, I think that there's probably going to be a lot of people that are reading this and say, well, I don't live in unincorporated Harris County. What are the rules for, you know, these places, these facilities in the non-unincorporated areas? Is there any regulation or how?
And Greg, I don't know if I really should turn this over, because what I want to say is it's not for the independents and the 55 plus, but in the cities, you may have more information as to, because you give that information out to family members.
So the assisted living, keep in mind, they're only regulated by state rules. There's no federal oversight whatsoever. So when it comes to the ones that are not under this rule, only the nursing homes are required to have generators, but again, those generators are very limited in what they operate in most of the facilities. In most of the facilities, they do not operate heating and ventilation, and they're not required to. In the assisted living world, outside of this unincorporated area, currently as it stands, they're not required to have a generator at all in the assisted living side. And I know that other Harris County officials and local officials are working on that right now. But then I hope to see that change soon.